All right, I think we're good to go. Hi, everyone who's watching on the Canadians for Long-Term Care YouTube channel. Welcome to our second 10+3 Town Hall meeting. Very excited to be here. My name is Melissa Miller. I'm one of the co-founders of Canadians for Long-Term Care. And today is our Liberals Day. We have special guests joining us from the federal and provincial Liberal Party. Very honored to have Yvonne Baker, Anthony Housefather, and John Fraser here. Yvonne Baker is an MP from Etobicoke Centre, and he also came and spoke at Parliament Hill for our Broken Hearts Empty Shoes demonstration that we had on Parliament Hill in November. Very happy to have you back again, Yvonne. And Yvonne was very instrumental in kicking off the national standards issue all the way back in May of 2020, as his riding had one of the homes that was the subject of the military report. So Yvonne's very familiar. We're very excited to have him here today talking about national standards. Anthony Housefather is an MP from the Mount Royal riding in Quebec and has a lot to say, I'm sure, about what's been going on in Quebec in long-term care. Very excited to have him here. And John Fraser, MPP from Ottawa South. Very happy to have you here too, John. So we are going to, I'm going to turn it over actually to my co-founders, Dr. Vivian Stamatopoulos and Kathy Parks, to introduce themselves before we get into the meat of things. Vivian, go for it. You're muted.
Typical.
Out of 2021.
We're muted.
Sorry, I'm here. So I don't know if I need to say too much about myself. I'm an advocate for long-term care, general big mouth for protecting residents' rights and their essential family caregivers. And I've just wrapped some research in terms of long-term care. So I'm just really excited to push this conversation along, and I really hope we can finally see some national standards. Kathy.
Yes, thank you, Vivian. My name is Kathy Parks. I'm a family advocate. My father was in Orchard Villa long-term care home. He passed away. I was just actually thinking that today marks the last, I saw him a year ago. That was the last time I saw him, was today, before they went into lockdown. And so, you know, it's important conversations we're having, really important to myself, people like me who have lost family in long-term care during the past year. And I'm really looking forward to the discussion.
Thanks, Kathy. I actually forgot to say a little bit more about myself. I'm a partner at Howie Saxon Henry. I'm an elder law advocate, nursing home negligence litigator. And Kathy and Vivian are two of my wonderful clients who are on this journey with me in trying to achieve these national standards. So before we get into sort of the question and answer portion of the evening, I'm going to turn it over to each of our guests to share their initial thoughts on why national standards are important and you know, their position. So Yvonne, let's start with you.
Thanks very much, Melissa, and thank you all for having me, and to all those watching, thank you for joining in this really important discussion. I want to just start by thanking the team from Canadians for Long-Term Care for organizing this town hall and the prior town hall and the future ones that you're organizing. Really, it's an honor to be here with people who I think are three fantastic advocates, right? Vivian Stamatopoulos, Melissa Miller, Kathy Parks. The ideas you've put forward, the advocacy you've done has been incredible and has made a big difference on this issue. So thank you. And also really thrilled to be here with my colleagues, Anthony, who I serve with in Parliament and has been a very strong advocate for national standards in caucus and elsewhere, and John Fraser, who's been a strong advocate at the provincial level. And I will tell you that John and I used to serve together as MPPs at Queen's Park. John was either the seat next to me or a couple seats over. So John, you can't get away from me no matter how hard you try. So really, I'll just share some quick thoughts and looking forward to the question and the discussion. In my riding in Etobicoke Centre, we're mourning the loss of 42 residents to COVID-19 at the Eatonville Long-Term Care Centre. And as Melissa alluded to, the Canadian Armed Forces personnel who were providing care at long-term homes last spring, they were also providing care at Eatonville, and they documented horrific conditions. I think we all know that. And the stories and the examples of the abuse by the soldiers stationed at these homes, I think, are just like, they're beyond reprehensible. And I think they're the kinds of allegations, or the kinds of stories that should alarm every single Canadian. And we know that this tragedy is not just taking place in a Etobicoke Center, it's taking place across Canada. We know that for a lot of reasons. One of them is because 80% of all Canadians who died from COVID-19 were living in long-term care homes. So I think sometimes, we're focused on the statistics and the numbers, and that's natural, especially during a pandemic and a crisis like this. But I think it's important that also when we talk about this issue, that we remember these people, we're talking about human beings, right? We're talking about mothers and fathers and brothers and sisters, and they deserve better. So I believe seniors in long-term care homes and their families, like, they deserve to know that reprehensible practices like those documented by our forces will never happen again, and that our seniors will receive the quality of care that they deserve. So that's why in May, 4 MPs, I'll mention them by name: Jennifer O'Connell, Gary Anandasangari, Judy Scrose, Sonia Sidhu, and I wrote a letter to Premier Ford, and we wrote a separate letter to the Prime Minister. And we asked for a number of things, but one of the things we asked for was that they work together to establish national standards for long-term care. And since May myself, I've been advocating alongside many of my colleagues. Anthony Housefather is one of those colleagues in caucus and elsewhere for national standards. Here's why I think national standards are so important. I think I'm a big believer that you measure what you treasure. If we treasure our seniors and we treasure the quality of care that they receive, to me, the only way to deliver that quality of care is to set a standard of care, to measure that performance against that standard, and enforce that standard. And I believe that national standards are the only way to ensure that the necessary resources are invested and the reforms made to ensure that long-term care homes provide that quality of care that I think we all believe our seniors deserve. In September, in the speech from the throne, I have to say I was very pleased when the federal government committed to work with the provinces and territories to set national standards for long-term care. I think the Prime Minister has restated that commitment to national standards countless times. Most recently, in a panel town hall discussion that Vivian asked the question about national standards in that conversation with the Prime Minister. So as we speak, that work continues with the provinces. The federal government's continuing that work with the provinces. But here's the challenge, and I just have to be frank. Some provinces have said they don't support national standards. And so I hope that all of us, and I'm talking about all of us, the 6 of us, but I'm also talking about everybody watching here today, that we got to redouble our efforts to advocate, encourage provincial governments who have not signed on or not signing on to work together to do just that. I think if we do that, and if it's done properly, we'll ensure that the tragedy that happened in Eatonville, the tragedy that's happening across the country, will never happen again, and that seniors in long-term care get the quality of care that they deserve. So thank you again for having me, and I'm really looking forward to the questions and the discussion.
Thanks so much, Yvonne. That was great. And I know Kathy's going to ask you a question about that letter, and we've got it. So she's going to share her screen with us later so that everybody can see it, because it's a great letter. Anthony Housefather, I'll turn the stage over to you so you can tell us about yourself and why these national standards are important to you.
Well, thanks very much, Melissa and Vivian and Kathy. And it's a real pleasure to be here with you and everybody who's watching online, and with John and with my colleague Yvonne, who's a good friend and somebody who shares my passion for this issue. I represent a riding in the western side of the island of Montreal. And Montreal was the original epicenter of the pandemic. Long-term care facilities in Quebec were at the core of that epicenter. And I had numerous long-term care facilities in my riding where over 100 people were infected, and over 50 people died. I had Vigie Mont-Royal, I had Maimonides Geriatric Center, I had the Jewish Hospital of Hope. I had a number of long-term care centers where there was great difficulty. And I used to be the mayor of my community before I was elected an MP. I literally knew dozens of people who were sick or who died at the beginning of the pandemic. I also have visited all of those long-term care centers before the pandemic, and during the beginning of the pandemic. And I saw exactly what was happening, because the pandemic was simply a horrible event that occurred in these long-term care facilities that were already problematic in terms of level of care and level of service. I had complained on many occasions about the fact that you still had rooms where you had more than one person, sometimes as many as 4 people in a room, way outside the norms of today. I had complained about the fact that there was not a doctor on site all the time in homes of more than 200 patients or residents. I had complained about the fact that nursing was being cut and that the level of nurses and what we call in Quebec PABs, the orderlies, the personal aides, what was at a level that was reminiscent of what it was 30 years ago when people in long-term care were 15 years younger than they are today, and much fewer of them had dementia. So there was already a problem that was going to happen before the pandemic, and the pandemic exacerbated it. So right at the beginning of the pandemic, I joined a protest outside a long-term care facility when the province announced that personal caregivers and family members could no longer enter the long-term care center. Because I said right away that people are going to die of neglect and dehydration and starvation if these people cannot go in, because the nursing staff is going to be completely overwhelmed, which is exactly what happened at multiple long-term care centers. So I became very much wedded to this issue, not exactly a popular stand in Quebec, where our provincial government doesn't like anyone intruding in their jurisdiction. I saw when Yvonne and Jen and Gary and Judy and Sonia signed the letter that they were doing something in Ontario that I was already trying to do in Quebec. So I asked if I could work with them. Since then, we've worked, I think, pretty effectively in caucus to push the Prime Minister, to push Cabinet on the path towards national standards in long-term care. And whether or not provincial governments like it or not, the federal government needs to put its money where its mouth is, develop standards in conjunction with the provinces and territories that are reasonable, that mean that seniors in these residences will live in dignity, improve home care as well, because we want to prevent people from having to go to long-term care as much as possible, and impose those standards in return for funding. I cannot see any other way to do that, and embarrass those provincial governments that refuse to take the money by saying, look at all these provinces that got so much money in funding, and you're taking none for your long-term care residences because you're too proud to accept money and accept national standards. And again, I know that's not necessarily a popular opinion in Quebec, but that is definitely my opinion based on my experience with long-term care centers in my riding and across the country. So that's sort of where I come to this issue from.
Thanks so much, Anthony, for that, and thank you for your efforts in being one of those spearheading this at the beginning, because by the time I think we all heard the words national standards, you all had been working vigorously in the background. So thank you, John. You're next. Tell us why you, as a provincial MPP from Ontario, think national standards are important.
Thank you very much, Melissa, and Kathy and Vivian, for your advocacy and for inviting me here this evening, and to my colleagues, of course, Yvan and Anthony. Anthony's the first time we've met. Yvan has great things to say about you. I'll just a little bit of background about myself. I was first elected in 2013, and right after I got elected, my father was diagnosed with inoperable oral cancer. So I followed him on a palliative journey at home and then in hospice. And then I had an election in 2014, about right after he passed away. And after I got elected, I was asked to be the parliamentary assistant to the Minister of Health and Long-Term Care. And I was asked what I wanted to do. And so I took a mandate on palliative and end-of-life care to build a provincial framework to advance palliative care in Ontario. And a lot of work had already been done. So I don't want to go into that work, but that's too much because I want to talk about long-term care. But that's the lens with which I see this. And one of the things that we did was build the Ontario Palliative Care Network, which set standards and gave the province the ability to measure palliative care in the province so that we could improve things like access. And the other piece in palliative care that I think is critical, we need national standards. Like that is a given. That's a point to start from. But we also need a collaboration. And one of the things that happened in palliative care was something called the Declaration of Partnership and the Commitment of Action, where I think 63 organizations came together to make a commitment. This is, it took a number of years to make a commitment to advancing palliative care in Ontario. So they range from associations, professional associations, to different organizations across Ontario. And that partnership was critical to building what we needed here. So when I look at the challenge that's in front of us, because there's a window that's open right now. And that window is a desire for change. And so we need to establish what the baseline and the standard is. But then we also at the same time have to say, how do we bring everybody in? Like if we're going to establish national standards and the government's talking about money, that money, number one, has to be tied. But how do we make sure, and I had never come up with, I don't know a better term to say this, it's used a lot, but has skin in the game. How do communities, right? How do provinces, how do municipalities? And I won't get into the weeds too much because I want to get to the questions, but think about schools, think about hospitals, think about childcare. They're all community-based. They have some community governments. They generally have a lot of involvement from the community. Why do we do long-term care differently? Like, why is that? And the last thing I'll say, so we can get to questions, is, COVID is the great revealer. Like, it shows us what was already there, sometimes in the extreme. But isolation was something that became particularly acute in this pandemic. But it's always been there. And it's such a determinant of health. I think that when we look at long-term care, that's one of the things that we have to look at in terms of a standard, right? We have to, whether that's essential, the rights of essential caregivers, or whether that's hours of care, or whether that's how we integrate long-term care into communities. And so that's a thing that sticks in my mind. And I'll stop there. I could fill up all the time, but I won't.
Well, thanks so much, John, for that. It's really great to hear that you've really got your thumb on the pulse of these issues, even pre-pandemic, because that's really what it takes to keep this conversation going. So I thank you very much. Kathy, I'm going to turn it over to you, as I believe you have our first question.
I do. And I just want to say something really resonated there with John, with what you said, is why do we treat our long-term care this way? That's an excellent question. That's, they're a forgotten group. Anyhow, on to my part. I'm going to speak directly with Yvonne, and I just want to address the letter. If you don't mind, I'll share the letter that you wrote. Everyone can see that on the screen. So this was written May 27th. And I think we all know that the military reports came out May 26th. I am wondering what was the driving force behind writing this letter?
Sure. Thanks so much, Kathy.
Yeah.
First off, let me just be frank. I think we were just horrified, to be frank. And we knew that this was something that was not just happening in our own constituencies. This was happening, the Canadian Armed Forces served in all 5 of our constituencies, so it touched our constituents directly. But we knew that the Canadian Armed Forces had only served in 5 homes in Ontario at that point. So we knew that this was a problem that existed elsewhere in Ontario and likely elsewhere across the country. And so we were horrified and we felt that we had to act. So that's what really brought us together around this. And then we wrote the letter because we felt that there was a short-term urgent problem that needed to be solved. And then there was a longer-term problem that needed to be solved. And so the shorter term was, it's COVID-19, steps have to be taken immediately to protect people. And the steps that we asked the Premier to take, I think the letter you're showing is the one to the Prime Minister, but in the letter to the Premier, who has jurisdiction over long-term care, we asked for some immediate steps, a mandatory management order over those facilities, a full public inquiry into what's happened and recommendations for how to solve it. And then, of course, to work with the Prime Minister and the Government of Canada on national standards. But in the letter you just showed to the Prime Minister, we focused on the national standards. And so I know I keep changing from one letter to the other, Kathy, and you're trying to keep up. But basically, that's what we did, right? We wanted to tackle the short-term issues, right? Because people were dying in that moment and were being mistreated in that moment. And this was particularly impactful in the context of COVID. but we wanted to also tackle the long-term problem and making sure that seniors get the quality of care that they deserve. So that's really why we wrote the letter. We were horrified. We felt that we had to do something, and we wanted to make sure that all governments, everybody came together around this. I'm of the view that, and I think this should be the case for every issue, but when it comes to our seniors in long-term care and what's happened and how they're being treated in many homes, like I don't think we should allow, I think Canadians wouldn't tolerate for us to allow jurisdictional politics to get in the way of just doing what needs to be done. And so I think we felt that we had to step up, quickly, and that's why we did that.
Yeah, I mean, it all came at an important time, and I think there were a lot of people speaking, but that's an important letter to have sent, and I thought it was important to revisit it. And I just want to then follow up as well. So we're now closing in on a year, really. We're talking about a year now from lockdowns in long-term care homes, almost a year to the largest number of deaths that we saw, especially in Ontario, but also across the country. A year, almost, we're 10 months from writing that letter. So I just want to know sort of where we are in the process, as much as you can share or talk about it, to achieving national standards for long-term care.
Yeah, absolutely. So just to recap, so for your viewers who maybe aren't familiar with some of the details, so in September, the federal government committed to to working with the provinces to establish long-term care national standards in their throne speech, which is the document that sort of outlines the government's agenda. And so since then, the government's initiated and has ongoing discussions with the provinces on this. Basically, I think, and the Prime Minister outlined this recently, the approach here is to start working with the provinces who are willing to move forward on national standards. And there are a number of them who are, and figure out what the best practices are across the country. Who's doing what well in what settings, consulting with experts. And the goal would be to come together to form sort of a national framework or national standards. And that's currently what's happening, or the latest update that I have anyway, is that the federal government's in those discussions with the provinces, especially those who are willing to move forward and who are bought into the idea that national standards are a good idea. And a good number of those provinces are. It's not, I think even the Prime Minister's acknowledged, it's not coming along as fast as he would like. It's not coming as fast as I would like, but because there's resistance from some provinces. But I think the goal here is work with the provinces who are willing to move forward. And then it'll be very difficult, I think, once a number of provinces to sign on, for those who are pushing back, and Ontario is an example of a province that's pushing back, that doesn't want national standards. It'll be very difficult for a province like Ontario to justify to its citizens why other provinces have decided to come together with the federal government and address this problem, provide seniors with that quality of care that they deserve, and Ontario is not. And this would apply to other provinces as well. So that's where we are really in the process. Those discussions are ongoing. They're trying to move as quickly as possible, but those are the challenges as well.
Thanks for that, Yvonne. The next question I have is for Anthony. We know that Quebec was hit hard, as you mentioned earlier, and you mentioned a number of the homes specifically. Why do you think that based on the experience in Quebec, we need national standards? Like how do you get buy-in from Quebecers on this issue?
So I think that there's a distinction between Quebecers and the government of Quebec. I think that most Quebecers have seen, in the light of the pandemic, that we need standards for our long-term care facilities, whether you call them national standards, whether you call them quality standards. There needs to be some level of certainty wherever you go in this country that if you're going into a long-term care home, you will be able to get your own room, or at the very least, a room shared with one other person who is somebody that you're compatible with. You need to make sure that you get a bath every day or a shower every day. You need to make sure that you get decent meals, and not only meals that they happen to want to serve you, but some choice over the food. I mean, there's all kinds of things, that you have adequate nursing care, that you have a doctor on site, at least in homes that have over a certain number of people. I mean, there's so many things that I think we've seen from the pandemic that is not, the first thing I guess provincial governments need to understand is that this is not being done to blame the current provincial government for whatever happened, right? If we're going to go about it at, we, the federal government, are smarter and better than you, and that's why we're having national standards, it's not going to work, and it wouldn't be fair, because it's been neglect over time by governments at all levels that have caused long-term care facilities to be where they are today. Constant cuts in funding, inadequate healthcare transfers, whatever it may be. So let's all accept accountability for the bad system we have now, and let's all agree on what are the minimum conditions seniors need to live in dignity. And if we can do that, and there's federal monies attached to it, why any province would say, we don't want those federal monies to improve our system to make sure that we meet these quality standards, then shame on them.
Do you think Quebec is going to sign on for national standards at the provincial level?
Well, given the current government in Quebec is not one that, my community really supports. My riding probably gave about 10% of the vote to the CAQ or maybe less. It's difficult because they don't have representation on the island of Montreal, really. They have one seat in the far east of Montreal. And so I don't have that same ability to speak with the provincial government in the same way that I did when the Liberal Party was in power provincially in the previous government, when both MNAs in my riding, so my MLAs were Liberals, and I talk to my MLAs all the time, and we have great contact. But I think that I have to guess that the government of Quebec is led by people who are pragmatic, that there's definitely a nationalist tendency in Quebec, where Quebec will be the last province usually to want to sign on to anything that is national in scope, because there is an element of nationalism that exists in Quebec, including among some federalists, but more amongst sovereignists. And the Quebec government doesn't want to be seen as weak or caving in or giving in on their jurisdiction. But that doesn't mean that Quebecers won't start pressuring them. And I do believe, again, in the great good sense of Canadians, and including Quebecers who are Canadians. It's very frustrating for me. I often hear people talk about les Canadiens, les Québécois, Canadians and Quebecers, forgetting that Quebecers are also Canadians. And people here have the same desire for their elderly relatives to live in good quality care if they go to long-term care. So I'm confident that there'll be enough pressure from the population, as long as it's not seen as the government of Canada imposing whatever views the government of Canada has on provinces, but rather as a real test of collaboration on what is quality care in Canada, and monies offered to reach that quality care. It will be difficult for any government in this country, including the Quebec government, to refuse.
I think that was extremely well put. Thank you for that. Now, I have a follow-up question. It wasn't one that I gave you a heads up about, but we have heard zero response from the Bloc Party. What is your sense of, as a federal party, about whether the Bloc will support this type of an effort? We've heard from the Conservatives. We know O'Toole is not on board for national standards. We invited O'Toole and his people to come and participate in our town hall series, and we didn't hear anything, which I think is very important to mention, because we do not see this as a partisan issue, the Canadians for Long-Term Care group. So I'm interested to hear, if you have any insight about where the Bloc is.
Well, I think we know where the Bloc is. The Bloc doesn't agree with national standards because they don't even believe Quebec should be in Canada. Yeah. So, they don't believe the federal government should even exist with respect to Quebec. So they certainly don't agree the federal government should have anything to do with standards with respect to long-term care in Quebec. Where we may have some type of ability to work with the Bloc is on the idea that there should be improved quality standards in long-term care. But, it wouldn't be that they would ever support the idea of national standards. But let's also remember, the current Quebec government is not a separatist government. The current Quebec government is a more nationalist and somewhat more conservative government, but its professed clearly that its intention is to work within the Canadian Federation, which is a different option than our constant back and forth between the Liberals and the PQ in Quebec. The PQ is a clearly separatist party. If the PQ were in power, I don't think anything would happen. But again, the CAQ is a pragmatic party where it's nationalist, but it is not closed to the idea of being part of the Canadian Federation. And I think that its desire to be part of the Canadian Federation, its desire to cooperate with other provinces, if all the other provinces sign on, I think it's much more likely that the CAQ government will sign on than if it was a separatist government. So let's remember the difference between the separatist Bloc Québécois and the more nationalist but still federalist CAQ provincial government.
Well, that was very helpful. Thanks for making that distinction. I think it's really important. Vivian, I think we're over to you.
Yes, because I've been itching to ask John some questions. John, my man, based on what we all saw happened here in Ontario, and I asked this rather facetiously, but do you think we need national standards?
You're muted.
Knew it was going to happen. There we go. Thank you, Vivian. I'm now unmuted. Yes, we need national standards, especially when you look at things like quality and access. Another piece I think that's important in a national standard is, and I actually have a private member's bill that puts this into Ontario legislation, it's like a patient bill of rights or a resident's bill of rights. So things to include things like a right to a substitute decision maker, a right to your information, a right to an essential caregiver, access in that regard. I think those are critical things, and we need to do that. And we need to all agree on that. Having said that, we actually do have standards in Ontario right now that we have really complex franchise agreements. That's what they are. I come from the grocery business. When I look at what their franchise agreements, and what is their challenge? It's actually making sure people live up to those agreements and with inspections and the actions that happen after the inspection. So I think the other piece that we need to do is build a collaboration. And again, I go back to this idea that we have to build capacity in communities to treat aging the same way we do with educating our children or keeping our populations healthy in hospitals. So I think that's a really big piece that has to be attached to that.
Yeah, I'm glad you mentioned, Bill of Rights, because one of the first things I did when I started my advocacy was when the March 13th directive came down, blocking, family and curiously lumping them as non-essential for some bizarre offensive reason. One of the first things I did was to write about how that blatantly violated the Long-Term Care Homes Act. So the problem is that we have a Residents' Bill of Rights, 27 Bill of Rights, but they were just effectively trampled over this pandemic, which is why, I worked with, Lisa Gretzky to table Bill 203 because we need to, in my opinion, we need to legislate visitor access because we saw how, pandemic powers usurped individual constitutional rights, which in my opinion was just the wrong way to go. I might disagree with some physicians on that, but most people I speak to are firm in the opinion that was wrong. So I guess my issue now and why we've been pushing for national standards, because I've seen such a reticence of the Ford government to actually, listen to the experts and listen to those of us that are raising very clear issues with certain policies that his government has put forward. And my concern is that, they're not going to want to play ball. Right. So my biggest fear are with Quebec and with Ontario not wanting to sign on. And sadly, those are the two provinces that were arguably hit the worst. So I want to know if you get that same sense that the Ford government is not receptive to national standards and what we need to do to get them on board.
Yeah, no, they aren't. There's no question about that because, the Doug Ford's message, Premier Ford's message is just send us the money. Just send us the money. And that's not good enough. It's the pandemic's been a great revealer. And the biggest challenge has been the government not been able to make decisions and do things quickly, right? Take action quickly and then communicate clearly. And if you look at everything, whether it's stabilizing the workforce, vaccinations, getting people out of 4-bed ward rooms. Anything they've done, there's been this reticence to take action. And this is in a pandemic. This is when you have to act quickly. So if that's what they're doing now, what's going to happen? Like we have this window where everybody's watching, and the opportunity right now is to push. I mean, the concern that I have is that window could close or get smaller, right? Because as we come out of the pandemic, people will be people will look at different things, and people become numb to what's happened in some. And I think that you know this. So I think that the federal government will have to be pushed to do it. And because right now, I get even just the response to what's happened in long-term care really lacks an acknowledgement of how much people have suffered, right? Like just doesn't, it just overall. And when I, with the minister in particular, every day sending out on social media, literally a tweet that says, it's not that bad in long-term care. Really, it's only this many, all these homes are really good, but not, but it's just like, that's just not right. Because number, it's not the whole picture, but more importantly, there's a whole bunch of people who are really hurting, right? And then I won't get into the commission, but the response to the commission, which is don't give them an extension, bury them in documents. Even the minister gave her notes at 11 o'clock the night before she had to testify. So it's just like they're not taking it seriously, no matter how much they say they are.
Yeah. And that's been my concern too, John. And I'll tell you, those tweets by the minister have been very poorly received by families. I mean, it is just a slap in the face to all these families to get the least worst case scenario, pushed out as what seems to be just a PR strategy, because she was doing this when we were losing seniors by the hour, right? Because there was quite a long period there during the second wave where indeed we were losing hundreds a day. It was horrifying. And still no acknowledgement that things are bad. No ever acknowledgement that we messed up. No acknowledgement for the many bad actors that have documented negligence that resulted in mass casualty events. Not one press conference saying, yes, these people are bad actors. We're going to revoke a license. We're going to do something. I mean, these families have had no justice. It has been just the most upsetting thing to watch. And indeed, the fact that they just seem to not understand, or it's just strategy to pretend it's not so bad, and that people that aren't paying close enough attention don't realize how bad it actually was and how bad it got. I mean, at this point, I think I'd just love to open it up to everyone and just, what do you think you need from us and from Canadians to really push this along? Because I think, as Anthony had mentioned, this is the public request. Like, people want this to happen. The public wants national standards. The public wants justice. It is a lack of political will, I think, that is really behind the stagnant action. And that's how do we get people to see this the way we all see it, is what I guess I'm hoping to get some insights.
Well, I'm happy to take a stab at that, if that's okay. I mean, I think, Vivian, I was just thinking as I was listening to John and Anthony and yourself and the others, I really, at the beginning of this town hall, I thanked you, your team and the whole team, for organizing this. And the real reason I think these town halls are so important is not only to give voice to the problem in long-term care, and we've articulated that here today, but to help do something about it, right? And so, to me, when I think about what has to be done, and that was your question, for me, I think, I want to be very clear, I'm not mincing words. The reality is there's a number of provinces that are bought in, the federal government is bought in, and they're working together. And there's a couple provinces, at least a couple, that are resistant, have said no publicly, and we've spoken about that. So the question is how do we get them to say yes, right? And I defer to my colleague Anthony on what's appropriate and best in Quebec, what the approach should be there, the strategy. But from my vantage point, I think there's a few things. There's a few things that we can do as a federal government, and Anthony and I and others are working on that. And then there's a few things that I think your viewers can do and you as advocates can do. I think on the advocacy side, I think it's reach out to those provincial governments that we've talked about, others if there's resistance, and express your point of view, the problem in long-term care, and that you believe strongly in national standards. And politicians need to hear from people. Doug Ford needs to hear from people. MPPs need to hear from people. John, I hope I'm not trampling on your turf here, this provincial turf, but still, I think those provincial governments that are resisting need to hear from their constituents to say, because I've been an MPP and I've been an MP, and when I hear from dozens upon dozens of constituents saying to me, I care about issue X, then that signals to me this is a priority to my constituents. And if it's a priority to them, it's got to be a priority for me. And so I think then those MPPs go into the meetings with Doug Ford and the minister and say, we've got to do something. Why aren't we signing on to this national standard? So that's my ask of you and the viewers out there. If there's one thing you can do after this, it's social media, but it's write emails and make phone calls and ask for meetings with your MPPs in those places and let them know how strongly you feel and that you want national standards. And then on the federal side, I think there's several things the federal government can do, and I think we're trying to do, but this is what I think we need to do, is we need to continue talking about it, people like myself and Anthony and others, and we need to make sure that we need to continue to move forward on this as quickly as possible with the provinces that are willing. And I think that's important for two reasons. One is because, like John said, there's a window, and I'm nervous that if that window closes, there won't be the same momentum behind this. And so we need to make as much progress as we can, as quickly as we can, with the provinces that are willing. And I also think that we need to, from my vantage point, the federal government needs to tie any future federal health transfers to national standards for long-term care, to a range of outcomes in healthcare, in my view, but certainly to effective, enforceable national standards for long-term care. So those are some of the steps that I think we can take, those of us in government, but also those of you out there.
Yeah, and Anthony, you made a comment earlier, how can you possibly justify to your constituents that you're turning down money for the pride of not wanting to be governed by federal national standards, which are not governing standards? That's not the intent of them. I thought that was brilliant when you said that. And I interrupted you. You were about to speak. Go ahead.
No. Thanks, Melissa. I mean, I'm sure whatever you were going to say was more brilliant than anything I would say anyway. I was going to suggest that I think that there's two things. I agree with Yvonne that we're in a window where you have two national parties that are talking about national standards, the Liberals and the NDP, and you need to capitalize before the next election if possible. If there is an election, then you need to galvanize groups of people that will support candidates that are in favor of national standards for long-term care, because you definitely need to make sure there's a majority in the House of Commons that believes in it. And in terms of the provincial side, right now, we need to deal with the governments and the MNAs that are there, MLAs in Ontario. To me, there's two things. In Quebec, we have users committees at every long-term care facility. It would be great if the groups in Ontario, because I imagine you have the same thing, and you guys can show real leadership in this, reach out to the users committees at every long-term care facility in Quebec and Ontario and organize lobby days where you guys go to Toronto or Quebec City, when hopefully COVID is over, but until then, virtually lobby days where you try to arrange meetings in groups with every MNA, every MLA, and try to convince them of the merits of this, whatever party they represent. That to me was always the most effective way of actually bringing an issue to Queen's Park or to Quebec City, is lobby days. And lobby day for long-term care national standards is a lobby day that I think would provoke lots and lots of participants and probably gain you meetings with every single member of the legislature. And that way, I think that there's a way to convince MLAs and MNAs that may be divorced from the issue of national standards as to why they're important. So that's what I would recommend. I think again, this is now at the provincial level, a citizens' battle to convince the members of the legislature that this is something that the population truly wants, truly supports, and that they'll pay a political price if they don't go along. That's my 2 cents.
If I could just step in really quickly, I'm just trying to be mindful of the time too. And we have 2 more topics we really want to discuss. I think we could have actually been here for probably 2 hours. We have so much to say. So we really want to discuss, Vivian has a question, and we also want to touch a bit more on jurisdiction. We also want to be mindful too, a lot of us are from Ontario and we're here from Ontario and Quebec, but we are talking about this nationally. It looks different in every province, but we're doing it for every single Canadian. And John has something he's on to say. Yeah.
You need to create a PAC. So the work you're doing is great. You need to create a PAC, a political action committee that continues to pull people in that have the same interests as you. So whether it's the OMA, whether it's faith groups, whether it's, just continue to build that coalition, because it'll give you the ability to take the kind of action that that Yvan is talking about that has an impact on decision makers. And I'll leave it at that.
Yeah, we're working on that.
Yeah.
There's a lot going on
It's very
behind the
helpful.
scenes. Okay, I was going to touch on the jurisdiction issue, but I think we've talked about that. And just to sort of recap for anybody who's new, who wasn't here last week, the reason why we called this the jurisdiction issue is because, as we've heard, long-term care falls squarely within the ambit of the provinces. And I think what we're hearing consistently today is you tie money coming from the federal government to standards. That's how you can get around the jurisdiction issue. This is not an attempt to interfere with the province's inherent jurisdiction in the long-term care sector. And it is not an attempt to micromanage long-term care within each of the provinces. There's a recognition, what I'm hearing, that the provinces can still make their own determination about how and when they're going to spend that money. Although I think we can all agree that needs to be attached to some accountability and transparency. What I want to ask about is, we've heard some talk about removing profits from long-term care. And I want to talk about this. I want to hear what each of you have to think. But before we get into this topic, I think it's really important that those watching understand there's a difference between the proposition to buy out the existing companies, which I've been hearing is, from those who are against getting rid of the for-profit model, is a very expensive venture. There's a difference between buying out for-profit companies and moving towards a not-for-profit model. And I would like to, hear what you guys have to say about that.
Who's going first?
Yvonne.
I can. Do you want me to go first, or John? Did you want?
I can go first. Look, I'll say this. I think, and we may not have some agreement on this, is when I look at what's happened here, it gives me no desire to continue to build for-profit care. It just, and in my riding, the homes that are there, and there's 800 beds, are not for profits, and that's my experience. And it's just not working, right? That's the way I see it. It doesn't work. And then we're involved in a process, in the party policy process, to talk about that. So that's something I'm looking forward to listening to. So, and hearing what people have to say. And just as Melissa said, it's a lot of toothpaste to put back in the tube. And we have to make sure that what we focus on right now, as we get to, I think, a different model, we need a different model, is to ensure that the residents' daily needs and their care is the thing that we lean into, if we're going to lean into anything. And so the other piece that I want to add in is that I believe, I just think it needs to be a collaboration. And I've said this already once or twice. We need to treat long-term care the same way we treat schools and hospitals and childcare. It's that simple. And build capacity in communities. That's why I not only think that we have to tie money, that the federal government doesn't just have to tie money to a standard, but they have to tie their money to other people's money. Right? Maybe not in the same quantity, but I believe in leverage solutions. So I think that that's the way forward, is to leverage solutions with provinces and municipalities and communities to build and do the right things, or do what we need to do to take care of frail elderly people.
Maybe I'll go next.
Yeah, go ahead.
I don't necessarily share the same experience or necessarily the same views. I mean, I think if we're doing this like schools, we allow private schools in the same way we allow public schools. I think the real question is, first of all, is it necessary to deal with this issue as part of national standards? I do not think so. I think national standards should apply whether a home is publicly run or privately run. And it's up to the provinces to make sure those standards are enforced in every single home in the province that offers long-term care. In the pandemic, I noted that some of the best and least affected homes were for-profit ones in my riding. I have 2 for-profit homes that had no cases of COVID, when all of my public ones had many, many cases. I've gone into some homes where the cuisine is like a restaurant or like a hotel that are private homes. And I've gone to public ones where everybody practically was regurgitating their food and crying to me that they can't eat because the food is so horrible. So the idea that I want to take away people's choice of being in a small private home that offers, services that are far above in the public sector currently does, I don't think that's the answer for long-term care in terms of standards. The issue is every home, whether private or public, needs to rise to the level of the standards that we set out. And if they don't, they should have to close. I mean, that's really, to me, the current issue. Maybe there's a future issue as to whether or not public or profit or whatever should be in the long-term care sector. But I think there's another priority right now, which is making sure that anything that exists today has to meet the standards that we think are both fair and realistic to make sure every senior can live in dignity. And that's my priority right now. So I think we may be going too far and confusing the two issues. There may well be something that people need to look at the provincial level as to whether or not everything should be public or for-profit should exist or whatever. But I don't think that's part of the question about enforcing national standards. And so I guess I'll just leave it at that. I'd rather that we concentrate on where the real issue is, or whether they're public or private, everybody should have at least a minimal level of care that we think is required for a decent life. Thanks.
If I could just jump in really quickly, I think, we don't want to confuse the two either. We are talking about national standards and a standard of care for sure. But I think the three of us have always said that our end goal, everything that we do comes in steps, and our end goal is removing profit from long-term care. So certainly, it's not necessarily in what we've been discussing in the national standards, but we all want to see that happen in the end. And although perhaps you may have seen some for-profits in your area that did better, the statistics simply show that they didn't do better. They certainly didn't in Ontario. And I think that, my personal opinion, when we're talking about profiting from long-term care, I do not think the two belong hand in hand. And I think we all so that's kind of why we wanted to discuss it. I think Yvonne might have wanted to say something too. I saw him, so.
Yeah, I saw your hand go up, Yvonne.
It's okay, not a problem. I'd spoken a lot, so I want to give my colleagues a chance to weigh in on this one. I think from my point of view, a couple points. One is that I've had a similar experience to what Anthony's had. Some private homes that have done really well, and some private homes obviously that have not done well. And I really think we've talked about like the limited time horizon that we have to establish national standards. And we've talked about the amount on this town hall and the amount of advocacy that's needed in a short period of time. And we've all spoken about what we think those steps should be, what that advocacy should look like. So first point I want to make is, I think in the short term, our first focus, and ideally our unified focus, should be on national standards. I'm just being totally pragmatic, because if we don't get the national standards in, you can eliminate all the for-profit care you want, and you still won't have the level of care that we think seniors deserve. So I think we have to prioritize and start with, let's get those national standards while the political conditions are there for us. So that's the first point I want to make. The second point I want to make is, and the reason I'm comfortable with, I think that's the right approach, is look, if you set the right standards, and they're the right ones, right? And the devil's in the details, I get that. But if you set the right standards and you enforce them, right? And if providers, public or not, or private don't deliver, they get shut down or taken over, whatever the remedy is, then I think what that does is that provides a tremendous amount of incentive for every operator, public or private, to deliver the quality of care that we want, which is our goal. Now, I'm open to the argument that even if you did that, the national standards, and they were effective and enforced and everything else, that private care can't be as good as public care. Like, I'd like to see the data that backs that up, and I'm open to that argument. But what I really think I'd urge us, at least in the short term, to really focus on the immediate battle, because this window will close. The window John's been talking about may close. And if it closes, then I'm concerned we'll lose the battle. The last thing I'll say is there are folks on either side of this private versus public debate. And so if I'm just being pragmatic again, if I think there's a lot of people get their heads around national standards, and Anthony talked about how people feel about standards, but not everybody's maybe on the same page on the public versus the private discussion. And I think you want to build as broad a coalition of people as possible. And so, try and build that coalition in the short term, that would be my focus, but open to talking in the future about what the right models are.
Yeah, I'm going to jump in because I feel like we need to lay the playing field here. I'm going to jump on John's side, just in that I've been very clear from day one in that I think national standards are needed right now to address these fundamental issues before even dealing with the longer divestment, in my opinion, that we need to do for-profit. And I get that. John, I think, has been, on my side in this, in terms of we've seen the evidence and how bad it is in Ontario with for-profit. And I get that in Anthony's situation, it would be different because the majority of homes in Quebec are indeed nonprofit, right? So you don't have the same extent to look back and see the evidence in terms of, well, Ontario, we saw it so flagrantly here. And there's a body of literature pre-pandemic that shows just the business model, both here and internationally, just doesn't work. In the long term, when it comes down to resident care, staffing, the conditions of work, which end up being the conditions of care, all of these things. But yeah, I do agree that the first thing we need to do is get certain key benchmarks in place, and that ideally those would weed out both the bad nonprofit or the bad for-profit. And in Ontario, just tends to be more of the bad are the for-profit ones. But that's not the case in Quebec, right? So I'm aware of that too, which is why I want as soon as possible to get standards in place so we can start weeding out any of the bad actors on whatever side they are on, and then deal with the larger next steps, because we know that the way we're handling it right now just isn't working. We need to think outside the box. We need to start looking at, European models of how we handle long-term care, both, institutional and home care. And we need to start really just being creative. And I think that's the next set of conversations that we're all going to need to have, because, what is it? 10 million Canadians, I think, are going to be 80 by 2025. I mean, we're getting to that point. We need to do something. We need to do something now. We don't have the luxury of time to keep passing the buck, right? The long-term care buck to the next government. We have to do something now. And if we don't, shame on us all. And these, I think I heard today, 15,000 deaths, Canadian deaths in long-term care will be in vain if we don't do something now. So I think that's how I would want to end it off. I think we're already getting towards the end of the time here. But ladies, if there's something I'm missing here and you wanted to jump in, thank you.
Well, yeah, I did, but it sounds like John wants to just say something quick, and then I'll wrap things up for us.
We have standards right now in Ontario. We need better standards.
Yeah.
So there's an issue around accountability.
Yeah.
And it's very difficult. They need to be accountable to communities, not accountable to a ministry office in downtown Toronto or a corporate office somewhere else, right? In downtown Toronto. They need to be accountable to communities, not have their accountability someplace far off. And that's my point with regards to, we need standards. And if people want to pay for their own care, but if we're going to invest money, we need to have accountability for that. And we can do that in communities.
Yeah, and I think the way that you achieve that kind of community accountability is with transparency, publicly available documents that, disclose how you are using government funds. And what I wanted to wrap up the for-profit, nonprofit discussion with is, food for thought for the three of you, as we wrap up our discussion. And I thank you all so very much for joining us today. I think the reason why these issues get put together is because there seems to be a distaste among many members of the public, especially the families of those who've lost loved ones in long-term care. There's a real distaste about the idea of taxpayer dollars somehow benefiting the bottom line of shareholders. And it's not just an emotional reaction. I think there's some legitimacy to that. And I think that's why that issue is, it's not a moral debate. It's really not. And I think that it might sometimes seem that way. It's not a good versus bad. There's something intrinsically distasteful to many that I think needs to be considered about those lining their pockets on the backs of taxpayer money. And that's a very simplistic way of putting it. Obviously, I know it's far more complicated than that, but to the average person, that's the question that's, you know, kind of rattling around our collective brains. So anyways, like I said, food for thought. We're certainly not going to solve all of these issues tonight, but I thank you all so very much for coming and participating today. Your input is invaluable. Your efforts are so greatly appreciated. All of you, wonderful. So thank you so much.
And thank you so much, everyone, for joining us. We really appreciate it.
Thank
Yeah.
you.
Subscribe to Canadians for Long-Term Care on YouTube, please.
Have a good night, everyone.